Hi, I'm Dr. Satal with Insight Functional Health, and thanks for joining us today. Today we're going to talk about vascular health, and I put this in the Foundation series because essentially every place in your body gets its oxygen and its nutrients from the vascular system or from the blood vessels. And it's not really the large blood vessels so much that you think about. It's more the capillaries or the teeny tiny blood vessels. And that is where you actually exchange oxygen and nutrients into the tissues in your body. And so if this is a cross-section of a capillary, we used to think that the innermost layer was something called the endothelial cell, or the lining cell of that blood vessel. And you have endothelial lining along all the blood vessel walls. But there's actually a protective layer called the endothelial glycocalyx that's inside of that, or that's overlying that kind of as a protective coating. You can think of it a little bit like a Teflon coating or a slippery, slimy layer on the inside of the blood vessel wall. And that layer helps to protect the endothelial cells so they don't get irritated by everything that's flowing through the vessel itself. And this layer is very susceptible to damage. And so we typically like to see a nice thick layer, but with something like higher blood sugar or higher blood pressure, or if a patient has issues with oxidative stress and an excessive amount of oxidative load, then you can have an erosion of this layer. And once that happens, it leaves the endothelial cells exposed, so it's much easier for them to be damaged. And when we think about the damage, that's once these endothelial cells are exposed, which are the innermost layer in here, then you can have cholesterol and other things flowing through the bloodstream that can penetrate that wall and start to lead to lipid buildup and ultimately plaque and more significant vascular complications. And there are some people who have vascular disease that's primarily a problem with the microvasculature or the capillary level, where they're not getting good gas exchange across those layers. And then there are other people who have problems with the larger blood vessels. Think about a heart attack or a stroke, where there's an acute blockage of a blood vessel and now you have no flow downstream from that. And you kind of need both sides. You need the capillaries to be open and you need the larger blood vessels to be open. And when I work with patients in functional medicine, my goal is to help support all of the ways for this to be a healthy system. We know in this layer here, this is what actually produces nitric oxide, which is a gas, but that allows your blood vessels to dilate, and that helps you regulate how much blood flow is going into different tissues. So if you go for a run, you need a lot more blood flow into your muscles than you do if you're sitting at a desk. And it's the blood vessels that dilate, and they do that in response to nitric oxide, which is produced with a healthy endothelial layer and glycocalyx. When I work with patients, I also try to optimize. We look at blood pressure, we look at blood sugar because we know that that can erode this. We look at oxidative stress because that can start to damage that layer. And then as we support that, a lot of metabolic issues can start to improve. This is just one of the foundations. There's no one single thing that's the silver bullet, but I think this is an important one. So if this was helpful for you, we have a lot more content online on our website and also on our YouTube channel. And if you're a patient in the DC metro area, I'm located in Silver Spring, Maryland, and I can see patients in person or via telemedicine in DC, Maryland, and Virginia. You're welcome to go to our website and schedule a free discovery call at any point. It's great to see you. Have a good evening.